Hello everyone, my name is Jasmine Randall, and today we're going to talk about different supplements provided in the hospital. And today I will be presenting my presentation, Choosing the Right One. So here's an overview of the presentation. We're going to go over choosing the right supplements, and we're going to talk about the current status of the patient and the route of the supplements. Those are two important critical things that you want to look at when you choose the supplements. Then we're going to talk about different supplements. We're going to talk about oral only supplements, and then oral or tube feeding supplements, and then conclusions and questions. So, why is choosing the right supplement important? There are different supplements specifically made for different medical conditions and patient population. You may have someone that's on dialysis, you may have a diabetic, someone that's post-transplant, underweight, post surgery, end-stage renal disease, or malnourished, and they have different supplements out there for each of these conditions. The current health status of the patient will determine if the patient should receive the supplement via oral intake or enterally via tube. The aim of oral nutrition and tube feeding is to improve the patient's overall food and fluid intake to improve their clinical outcome. So we're going to talk about different routes that you can take and when to consider oral nutrition. You can consider oral nutrition when you have inadequate food and fluid intake, where you're just not eating enough. If your GI tract is not compromised, and this is including your mouth, throat, and esophagus, if these things work well, you want to use it. Like my thing, you either use it or lose it, so use those muscles and to continue to eat by mouth. And lastly, to treat or avoid malnutrition, and this is just to add additional calories to the food that you're eating. So usually as oral nutrition supplements are not intended as a sole nutrition source. You cannot just take these and drink these all day and be okay. You need to add this to your diet. Now we're going to talk about when to consider tube feeding. Tube feeding is considered when you have difficulty chewing and swallowing and you're not getting enough food. When you have a compromised GI tract, when these things such as your mouth, throat, and esophagus isn't working, as well as any intestines, you want to go below her with the tube. If you're intubated and sedated and you can't eat but you need the proper nutrition for healing. If you're deemed unsafe for PO intake. If you're extreme malnourished status, that means that you're just wasting away and they need to get food in you as quickly as possible. Excuse me. And also with post-surgical transplantation. They have situations such as they just came out of surgery from getting a transplant and they're intubated and sedated, so they actually need the proper nutrition but they cannot eat. Now we're going to discuss oral only supplements. Oral supplements play a key role in providing additional calories to an individual's diet when there is insufficient caloric intake. Be mindful that oral supplements are not intended to be used as a sole source of nutrition in most cases, but added to a diet to help increase daily calorie and protein intake. And we're going to discuss these three actual individual oral supplements: Ensure Complete, Ensure Muscle Health, and Ensure Clear. These three are widely known in hospitals and they're widely given out to patients. So if you do see these are something that you may see in the hospital. First, we're going to discuss Ensure Clear. Ensure Clear, the ideal candidate for someone who would prefer Ensure Clear. If they're on a clear liquid diet, they are actually a clear liquid. You can consume that. If you're post surgical, actually, if you need the additional calories or if you need it to heal, this is something that you can do. fat-restricted diets, individuals with involuntary weight loss, malnourished, and individuals at nutritional risk. All of these are pretty much there to provide additional calories to someone's diet when they have an adequate diet. And also is ideal for a patient who prefers a fruit-flavored alternate to a creamy shake-like supplement. So if someone that you have, they don't like the dairy or the creamy like, this could be something that can provide the additional calories, and it has a similar texture of juice. So this picture here is a 6.8 fluid ounce container, and it contains 200 calories, 43 grams of carbs, 7 grams of protein, has no potassium, no phosphorus, so it could be a potential drink for someone who just had a recent transplant, a kidney transplant, and they're trying to get it controlled, and 30 milligrams of sodium. Now we're going to talk about Ensure Complete and Ensure Muscle Health. They're pretty much kind of the same, but they have different components and they are highlighted. But we will discuss that in a minute. First, we're going to talk about Ensure Complete. Ensure Complete is an oral supplement, and it is given to individuals when diet alone is not good enough for weight maintenance. So this is just for someone who has involuntary weight loss, or they're just not eating enough food to get all their calories. So what you'll do is you'll probably give this to them 3 times a day or 2 times a day in between meals, and this can help provide the additional calories. And it targets muscle health, immune system, and bone support. And to your right here, we have Ensure Muscle Health, and this is the same thing. It's ideal for someone when their diet alone is just not good enough. And this is mainly kind of in someone in the elderly population who's not getting enough protein, or someone who's in recovery from a surgery and they need the actual protein for healing. And up here, it contains the protein to help maintain and rebuild lean body mass. And both of these are 8 fluid ounces. Ensure Complete to your left, it has 350 calories, 51 grams of carbs, and 13 grams of protein. And to your right, the Ensure Muscle Health, highlighted purple, has 250 calories, 30 grams of carbs, and 15 grams of protein. And at the bottom here, they both contain 560 milligrams of potassium, 350 milligrams of phosphorus, and 240 milligrams of sodium. The following formulas can be used either for oral intake or as a sole source of nutrition via enteral feeding tubes. These supplements are essential to providing calories to an individual if they are deemed unsafe for PO intake. And PO intake is just meaning they cannot eat by mouth. So we're going to talk about these 3 supplements, and these are kind of geared to a specific audience. So we're going to go through each one and kind of just see who the ideal candidate will be for this particular supplements, and we will go over each one and their different nutrition content like we did the others. So the first one we're going to talk about is Glucerna 1.2. An ideal candidate will include an individual with type 1 or type 2 diabetes, individuals with hyperglycemia or abnormal glucose intolerance. So not everyone who has these issues are diabetic. You may just got out of surgery, or you could be illness and your glucose levels are just not in the right range. So this could be an ideal drink for someone who has these things going on, and this can be used as a sole source of nutrition. Therefore, you do not need to eat anything else. This could provide all the calories that you need within a day. And the nutrition content for this picture below and for this nutrition information is for 1,000 milliliters, and that contains 1,200 calories, And you can see the big difference. The Ensure Complete and the Ensure Muscle Health, they were providing 200, 300 calories. But this alone could be something that you can take in and have it all by yourself. 114.5 grams of carbs, 60 grams of protein, 220 milligrams of potassium, 800 milligrams of phosphorus, and 1,110 milligrams of sodium. Second is Nepro. An ideal candidate will include an individual on dialysis or someone who has stage 5 chronic kidney disease. And features includes is low in potassium, phosphorus, and sodium, and it has excellent source of protein. So this protein may be lost during dialysis, and this supplement will help replace the protein loss. And this is again ideal for someone who has the stage 4 and they're on dialysis and they have that protein loss and they have these renal restrictions, which is the low potassium, low phosphorus, and the sodium issues. And this also can be used as a sole source of nutrition and nutrition content for a 1,000 milliliter, and that provides 1,800 calories, 161 carbs, 81 grams of protein, 1,060 milligrams of potassium, 720 milligrams of phosphorus, and 1,060 milligrams of sodium. And lastly, we're going to discuss Suplina. So Suplina is for someone who has renal disease but they're not on dialysis. So that would be stage 3, stage 4. And their features includes low in protein, potassium, phosphorus, and sodium. And what's different between this and Nepro was high in protein because individuals on dialysis, they need that protein in their supplements and their food to replace it that's lost. But these individuals, stage 4 and stage 3 kidney disease, they don't need the protein, the extra protein. So this has a low protein. And it helps maintain the nutritional status while following a very restrictive renal diet. And nutrient content for 1,000 milliliters of Suplina, 1795 calories, 196 grams of carbs, 45 grams of protein, 1,139 milligrams of potassium, 717 milligrams 717 milligrams phosphorus, and 802 milligrams of sodium. So in conclusion, there's plenty of formulas and supplements to choose from. So please be mindful of your patient's current health status. If they have a certain condition or a certain disease, it's very important that you note of this first before you just choose a supplement out there, because there's so many you can choose from and there's so many that provides for a specific population. And please take into consideration if the patient is suitable for oral intake or tube feeding. That's very important. You do not want to give someone something by mouth if they cannot swallow, if they're at risk for aspiration or anything in those conditions. And you wouldn't want to give someone an oral feeding if everything's working properly. You actually lose those muscles and those functions over time. And in addition, ask an RD for help and assistance if needed, or place nutrition consult for recommendations as needed. We're here and we want to help you guys. We know these things and we just want to make things right for the patient. So please do not be afraid to just reach out to an RD so you can get that help. Thank you. That was the end of my presentation. Again, thank you for listening and being here. Thank you.